So actually, Duchenne muscular dystrophy or dystrophinopathy in general is a very broad uh, condition, and it starts with the most severe form of Duchenne, and at the extreme spectrum of dystrophinopathy, we have patients with very mild symptoms, and this is there was a very interesting communication that did, by the way. Get the prize of the best Duchenne and dystrophinopathy presentation about patients with mild, very mild dystrophinopathy, those who present with just elevated CK or mild symptoms. And then there was also, several communication about Becker muscular dystrophy, and as you might imagine, a very interesting and important topic in Becker muscular dystrophy is the natural history of these patients, and how we can try to predict the severity of Becker. There was also a clinical trial, the one from Edgewise, to study fast troponin inhibitors that shows a significant reduction of several biomarkers of muscle destruction, and of course several studies on the course and natural history study of Duchenne. Of course, this is extremely important because we need to appreciate what is the best population for innovative treatment, including gene therapy, and for that we need a better understanding of the functional prognosis of this patient and how we can try to figure out according to biomarkers, but also patient's condition.
One of the challenges that we have in treating and also studying dystrophinopathy is the broad heterogeneity that we see. Some people use the term snowflake disease, as in each person is their very unique experience. And while we do have some general trends that we can see, it's clear from any work that's done on natural history or comparing people who are receiving the same intervention that this trajectory is not homogeneous across people living with the disorder. We really need to be better at predicting who is going to progress at what pace natural history wise, because we need to understand what timing is critical for interventions. This becomes even more important when the conversation of establishing an early diagnosis becomes focused on things like newborn screening. If we truly bring that into a global effort of identifying people with dystrophinopathy as soon as possible, we have to remember that some people are going to have an elevated creatine kinase level right from birth who are never going to manifest any sort of weakness or cardiac disease or pulmonary manifestation of their disorder. And therefore, those people probably should not receive an intervention that has risk associated with it if they're going to be so minimally affected in terms of their quality of life. This is hugely different than somebody who is going to follow the most severe Duchenne trajectory, where we have some patients that lose the ability to walk early in school age with that disorder, and we absolutely want to intervene as soon as possible for somebody like that, to ensure that we prevent as much neurodegeneration in terms of loss of muscle tissue as we can for that person who's destined to be more severely affected based on their genotype and various other factors. So this is critically important work that we are going to continue to need to do in the context of actively having treatments available now that we do have multiple genetically focused treatments, and soon to also be multiple muscle targeted therapies beyond steroid treatment, which we've used for a long time. We're really on the cusp of some other muscle focused treatments as well. So that work is critical to having a individualized or personalized medicine approach where every person living with dystrophinopathy has an individual care plan based both on when they're first diagnosed, how symptomatic they are when you start them on whatever their journey is, and also how they respond to the various interventions that we might offer as we have more and more in our tool bag.